Okay, let's talk about a little bit about the ages, kilograms, ET tube sizes, and some pharmacology or drug dosaging. Good old Harborview, I believe this is probably Harborview at Seattle, but they're just using a color scheme which follows Browslow or Hantevi, and you can create your own, but we would like you to follow the length-based tape when you are performing any type of pediatric resuscitation. And just to go over it, we use like a 1, 3, 5, 7, 9. You use your hands, uh, so you have 5 fingers. But if you close your fist, I'd say that's less than 1 years old. So you have less than 1, 1, 3, 5, 7, 9. So close your fist, it'd be 0. So that'd be less than 1. First finger out, 1, 3, 5, 7, 9. That's the ages in years. You close your fist, that's less than 1. They'd probably be 5 kilograms. You open one finger, 10 kilograms at 1 year old. 3 year olds, 15 kilograms. 5 year olds at 20 kilograms. Open your next finger, your fourth finger. 7 year olds at 25 kilograms. And the fifth finger, 9 year olds at 30 kilograms. So ET tube size, ET tube size, you're gonna go ahead and close your fist, and you probably have they're less than 1 year, so you can't do a 3.0 ET tube, but that'd be great if they were a good size. But 2 to 3 at less than 1 year, at 1 year 3 to 4, at 3 years 15 kilograms would be 4 to 5. At 5 years it'd be 15 20 kilograms at 4 to 5 ET tube size. At 7 years, it'd be 25 kilograms at 5 to 6 ET tube size. And at 9 years old, they're about 30 kilograms at about a 6.0. And you kind of gotta have your ranges. So it's, if you fall between one, less than 1 and almost 1, you're going up towards the 3 to 4. Again, if you're like almost like you're more than 1 and you're like 2.5 to almost 3, then you're looking at more a 4 to 5 ET tube size, and vice versa. So use these as kind of guide um, for us when we're talking about resuscitation. So epinephrine for your neonate resuscitation. This is under that 1 year. Our protocol is asking us to give zero point 0.3 mLs. zero point 0.3 mLs on your resuscitation, neonate resuscitation of the 1 to 10,000. That's going to be 0.03 milligrams. So we're just giving zero point 0.3, and we're going to see how we do with that. Um, if you are then at the 1 year old and moving further from the neonate, so you're more than 24 hours old and we're going past the neonate, it's going to be 0.1 milligrams per kilogram epinephrine. If we're using atropine, then it's going to be 0.02 milligrams per kilogram. Again, minimum dose for atropine would be zero point 0.1, maximum dose would be zero point 0.5. Continue with the cardiac arrest medication. Let's talk about amiodarone, which will be given 5 milligrams per kilogram, and lidocaine, which is 1 milligram per kilogram. You can also, give your subsequent dosages. Again, 5 milligrams per kilogram for amiodarone, 1 milligram per kilogram for lidocaine. If they're in a tachyarrhythmia, such as an SVT, then we can go ahead and give adenosine, 0.1 milligrams per kilogram. And second dose and subsequent would be 0.2 milligrams per kilogram. Max dose for the first dose would be 6 milligrams. Max dose for the second dose would be 12 milligrams. Let's talk about a little bit about your pain medications. You can give 1 microgram or up to 2 micrograms per kilogram of fentanyl. Again, fentanyl for narcotic pain management, 1 microgram to 2 micrograms per kilogram for fentanyl. And that would be in our standing orders. Morphine sulfate can be given. It's not in your standing order, but it can be given 0.05 milligrams to zero point 0.1 milligram per kilogram. The reversal agent is Narcan, and we'll give that at zero point 0.1 milligrams up to, and then we can also to 0.01 milligrams per kilogram. So 0.1 milligram, or we can go down to a lower dose, 0.01 milligrams, and work up to that zero point 0.1 milligrams per kilogram. So for Versed, for your seizure cases, you're giving 2 milligrams IN, intranasal, or IM. We can consider giving Versed 0.1 milligrams per kilogram, or Valium or diazepam 1 to 2 milligrams, and we can give that up. So we'll try with 1 milligram every 2 minutes to titrate up to 10. If you don't have Versed or Valium, then lorazepam is an alternative, zero point 0.1 milligrams per kilogram. And now when we talk about another dose for epinephrine, we can talk about that 0.01 milligrams per kilogram of 1 to 1,000. This is given during the anaphylaxis case up to 3.3 milligrams. So 0.01 milligrams per kilogram of the 1 to 1,000. This is IM. We're going to give 0.3 milligrams max dose. And subsequently, we'll be given our H1 blocker, which is Benadryl, 1 milligram per kilogram. So let's go ahead and just think about it. You have a 3-year-old who's how many kilograms? What size tube would you use? Try to figure out your epinephrine dose at 3 years old, 0.01 milligram per kilogram. At 3 years old, try to figure out your atropine dose at 0.02 milligrams per kilogram. Remember your minimum and your maximum. And go ahead for your 3-year-old, let's figure out your amiodarone dose at 5 milligrams per kilogram. Again, you're going to have to convert that into the kilograms because I just gave you the age, and try to use your hand method. Remember, closed fist is under 1. Your first finger and under 1 would be about 5 kilos. As they get to 1 years old, you can stick out one finger, and that's 10 kilos. Your second finger would be 3 years old, 15 kilos. Third finger would be 5 years old at 20 kilos. Your fourth finger would be 7 years old at 25 kilos. And your fifth finger for your whole hand being wide open would be 9 years old at 30 kilos.